Like I said, this is a virtual environment we're dealing with, so hopefully we'll get back to some more in-person events in the future. As such, since it is virtual, we will be kind of monitoring the lines, and if we see some mics, they should have been muted on the way in. But if we do see some mics open, we'll close those along the way, just so we don't interrupt the noise and all that during this. If you do have a question, we will have our leaders from the VHA here at the hospital, as well as our leaders at the VBA and the Nevada Department of Veteran Services, as well as our chief of staff providing some updates. And after that, we'll kind of go into a moderated Q&A town hall session. And during that session, we will take questions via the chat box, or if you want to email them, I put our email address in there as well. That's vhalaspao@va.gov. And we will take questions that way. And then I, as a moderator, will present those to the panel, to our specialists, to get your answers. So, and that's kind of where we're at. So I'm just seeing if Mr. Karen, our director's on. I'm going to turn it over to him for some opening remarks once he gets online here.
I'm on.
All right. So, Mr. Karen, sir, I will turn it over to you for some opening remarks, and then we'll go from there.
So it's certainly been some strange days indeed that we've been going through here as of late. I came on board here actually in June of 2019. So by the time I hit month 9, COVID struck. So we went from this very robust, dynamic, moving forward, getting out there, communicating with veterans and staff, and really trying to, these plans had created, and then the pandemic came into play. So now we've shifted gears, and as you've seen, we're into this virtual world for the most part, including this town hall here today. So it's presented some challenges, and it's certainly not ideal, but I'm very proud of the organization. We've managed over 600 COVID, or right around 600 COVID patients thus far, thousands and thousands and thousands of tests. And the great news is we've done an excellent job of keeping our staff safe, and most importantly, keeping our veterans safe as we've weathered this pandemic. Dr. Komanduri, a little bit later on, the presentation is going to talk about our moving forward plan and how we've been gaining steam trying to get to our pre-COVID volumes. I will say, in terms of the number of unique veterans that we've served, we're only off about 1.5% from last fiscal year, which I think is pretty tremendous considering the massive slowdown that we had, particularly in March and April. So that was encouraging. Our total outpatient visits are down about 10%, which does make sense considering that dramatic change in secondary to COVID. So I would ask that we continue to work together, remain vigilant. The governor spoke just yesterday, I believe it was. We are all suffering on some level from COVID fatigue, but we just cannot let our guard down. We really need to continue to practice universal masking, keep our physical distancing up, make sure that we're testing appropriately and using the appropriate supplies. We're very fortunate in our healthcare system. We've not had a shortage of personal protective equipment. The staff have all the supplies they need. We've done an isolated COVID unit for some times when we've had that surge this past July, August, which has been very effective. The communications have been daily coming from our public affairs group. I know we met with our congressional staffers today, putting out as much communication as we can in a very ever-changing environment that we're dealing with right now. So please bear with us. Our challenges right now are somewhat in the access, not so much in the facility and the clinics because we're doing a lot of virtual care, but in community care because of this bolus of consults that have come through now that things have loosened up within the community. Certainly our veterans want to get their care done in the community. So keep in mind that just like when you're working through your insurance company for an approval process, there's a timeline of about 14 business days in order to get that consult managed and processed through community care. So if a few days has gone by and you're calling and trying to get information, just bear in mind that it takes a little bit of time, just like any other insurance entity, process a consult that goes that's where you're going to be seen as a veteran outside of VA. Some exciting news on the caregiver support program. Been a long time coming. They've expanded that eligibility criteria as of 1 October, so that expanded program has gotten out there, and I think we'll put the website out on the chat box, Chuck, if we don't mind, so you can reference that for some of the new criteria and how that program is moving along. So we're excited about that. I wanted to share the importance of influenza vaccines this year. You're hearing about it all over the news, particularly for our population, our veteran population. I'm glad we did the drive flu shots, and our point of dispensation techniques have been very effective this year. We have many veterans that, because of COVID, had isolated in their home quite a bit. But when they saw that we had the drive-through option, we had some veterans that have come and gone through there were very thankful for it. It was an interesting story that a veteran had driven up to one of our sites to get their drive-through flu shot. And there was another veteran in the car, and routinely that individual did not typically get a flu shot, had not got one for several years. But because he was in the car, he had a captive audience, we finally convinced him to get a flu shot too, because he was stuck in the car with his friend. So I think that's a great story about how we have to be innovative, creative, and make sure that we get our veterans the influenza vaccine, because we certainly don't want a kind of that double whammy of influenza and COVID. So I'll stop there and I'll hand it off. I know we've got a couple other people to present before we open it up for questions.
All right. Thanks, Mr. Karen. We appreciate that update. Next, I'd like to give Mr. Franco Fritz, the director of our VBA here out of the Reno Regional Office, an opportunity to provide us a VBA update. Mr. Fritz, sir, the floor is yours.
Thank you. Good afternoon, everyone. So even in this pandemic, I'm proud to say that VBA has had outstanding performance during the pandemic, and we've actually served more veterans and processed more claims and appeals and BR&E services and home loans and everything else than we ever have before in our history. Who knew that all these people could do this much work at home? The one place, well, there's two places we've been impacted by COVID severely is in our public contact services, where veterans, you can come in and talk to a legal admin specialist there that can kind of either take a claim or work through a claim or do something. We haven't been able to open those. We have 11 regional offices throughout the United States out of 56 that have opened to the public in places like Boise and Fargo, North Dakota, a little bit sparser veteran populations up there. The 12th one to reopen is going to be Reno, up here in Reno. We aren't going to quite be able to get there yet, but I expect to open soon. On a limited basis, for appointments that veterans can come in and actually see us face to face again. I'm looking forward to that time, and hopefully it'll be within the next couple of weeks. But with that being said, we have our phone numbers, the local phone numbers, and the email address, so that veterans can contact us and get some information. And Val, if you could put that. Public Affairs Officer Val is online. She can put that in the chat box for everyone to see. And it's also posted outside the RO up here in Reno, and as well as in the front entrance of the hospital there. We have conducted almost 1,000 email replies and 2,000 telephone callbacks to veterans during the pandemic. But we know that a lot of you want to see somebody in person so you can explain the situation better. And so we're working very hard to get there. Veterans can also interact virtually with VBA by filing a claim online and calling one of our call centers. But we do have our local numbers posted, and we'll help you as much as we can. The other way we were impacted by COVID was we had a huge halt in exams, contract exams that we do for the C&P compensation and pension exams to assess your disabilities, done by contract out and I know a lot of you have had those type exams, but that has been resumed now everywhere, but it was a backlog there for about 3 months where we weren't able to even do those. The contractors, of course, they couldn't meet face to face either. So that problem has been fixed. We're starting to see the exams start to come in again, so that's a good thing. I just want to touch on a couple of updates on some of the things that you've been interested in the past, and some of the things that we're doing as an agency for veterans. The VA Home Loan Guarantee is trying to provide relief by allowing home mortgage loan deferments for veterans who have experienced financial hardships during COVID-19, so that they can defer their payments up to a year, their home loan payments. Now, not all financial institutions will do that, and VA can't force them, but there's a lot. You'd have to just call your institution and see if that's available, but the VA does support that, and they have guaranteed the loans. So that's one thing that we're doing. Many veterans have taken advantage of that loan forbearance program. It's provided by the Coronavirus Aid, Relief, and Economic Security Act, which is called the CARES Act, if you want further information on it. As far as appeals, I know veterans are always interested in appeals that they have in the system. VA has achieved a historic milestone in issuing appeals decisions this past year. We issued more than 100,000 decisions this fiscal year, and I know that's a lot, and because those things had been in the system sometimes 5 years. I know a lot of people are happy. A lot of veterans are happy that they're getting the decision so quickly now. They also completed over 15,000 hearings, and 4,000 of those were telehearings, virtual. So we keep moving into the future, and we're being forced by COVID to move into the future. A little bit of a federal records update. The National Archives and Records Administration and the National Personnel Records Center are both in very limited operations. They're out there in St. Louis, and so they have not been able to do much as far as getting records. Only what they can do virtually, and they only have skeleton crews working there. So what we have done as in our regional offices, and especially here, we accept uncertified service verification documents like DD-214s. There's that one certified copy that the VBA always requires, but we're accepting uncertified copies, as long as there's no indication of fraud or anything like that. And usually 99% of the time that's not the case. So we'll accept those. We're going to take claim actions, including exam requests and favorable education service connections based on service information documented in those uncertified copies of your DD-14. So until the Records Management Center and NARA and those institutions get back up and running we're doing everything we can to continue to take claims and get you the service you need. One thing that I had talked about in our last couple of town halls, I think that was pre-COVID, was the Blue Water Navy claims. Since January 1st, we've completed over 35,000 Blue Water Navy claims and awarded over $675 million in retroactive benefits. And that includes 510 Blue Water Navy claims for Nevada veterans, and these Nevada veterans have been awarded $8.7 million in retroactive benefits. So that's a good thing, and I'm happy to see that has happened for our Nevada veterans. That's really what I have as an update. I'll stop there and take any questions later on. Thank you.
Great. Thank you, Mr. Fritz. We appreciate you joining us today and providing that great update. Obviously, you know, it's a public-private partnership. It's also a state and federal partnership in taking care of our veterans here in Nevada. And we are very fortunate to have a great relationship with the Nevada Department of Veteran Services. So Mr. Fred Wagar, who's the Director of Operations for the Nevada Department of Veteran Services, has joined us today to provide us a state update. So, Mr. Wagar, I'm going to turn the floor over to you, sir.
Thank you, Charles. I appreciate it. First of all, I want to tell Director Karen that I was in for some labs this past week and asked where I could get my flu shot, and they said, get in your car, drive right around here. I did that. I used the drive-through, and surprising to me, they actually gave me a nice bag and a cap and the whole bit. So kudos on what you were doing out there, making it really easy for our veterans. I do want to start with our COVID update for the state for our 2 nursing homes in Reno, or in Sparks and Boulder City. And I wanted to let you all know that currently up north in our home up there, we don't have any residents with COVID. We did find out today we have one staff member who tested positive, but is a non-clinical individual, so no exposure to residents up there. Down here, we do have 1 resident with COVID and doing extremely well, no symptoms at all. And then we have 4 staff member with 2 with no symptoms and 2 with mild symptoms. So from the very beginning, we've taken every step we can to ensure the safety of our residents. Director Fritz mentioned the opening of the offices, and we're co-located with the VA regional offices in Vegas and Reno, and so we kind of are following their lead on that. But we are going to be very cautious when we open as well. We're still in phase 2 here in the state, and so at that point, we will still be doing a lot of virtual claims processing. We've gotten pretty good at it. We've increased our numbers considerably. And I do want to put that number out, and I'll also post this in the chat room, but the number to reach our veteran service officers around the state, not just here in the South, but around the state, is 702-830-2000. And again, like I said, I'll put that in the chat room. We also have our Ask a VSO button on the webpage, veterans.nv.gov. And that we usually get 20 to 25 a month on that Ask a VSO, and we've been averaging well over 90 per month on that. So it's everybody's kind of getting used to this virtual electronic thing, so we appreciate that. Our cemeteries, we're doing full honor ceremonies again. For a while we did direct burials only, but now we're doing ceremonies. In the South, we can accommodate up to 95 in our chapel, keeping social distancing. And up in Fernley, we can accommodate 50. And so we will continue to do that. We do have Wreaths Across America coming up. And anybody who has belongs to an organization that has purchased wreaths or are going to purchase wreaths will be contacted, and further information will be coming out on how we're going to do that to keep everybody safe. I do want to thank the Perry Foundation. They collaborated with us, our Women Veteran Service Officer, Beth Hemela out of Reno, worked with them to present the 3 virtual conferences for military sexual trauma. That was over the last 3 weeks. The first one was on October 6th. That was for those who experienced military sexual trauma and their caregivers. We had over 140 attendees. So some of these things that we do, these conferences that we do, we find out we get better attendees or better attendance when we do it virtually. Normally we get 25, 30 people to that conference when people have to travel or they have to show up for that. So we got 140 plus on that. On the 13th and the 20th, so yesterday, we had other conferences for MST. Those were for continuing education credits for professionals who are treating those who have experienced MST. The 13th, again, had about 140 attendees, and yesterday's had approximately 110 attendees. So very successful, and we have to keep in mind that military sexual trauma isn't just about women, it was men too. So we want to make sure that we take care of those folks, and we're very proud of that, how that happened. So the other thing I want to mention on this call is our Veteran of the Month and Veteran Supporter of the Month programs. I want everybody to know that if you have a veteran who is doing super things in the veterans community, really still out there helping veterans, we want you to nominate those for Veteran of the Month. And if you have a veterans group or just an individual who's not a veteran but doing fantastic things for veterans, nominate them for Veteran Supporter of the Month. I'm going to provide the links to these 2 pages from our website in the chat room after I get done here. Please click on those links, go there, nominate people. They're always looking for folks who have done great things for our veterans community. And finally, if you'd like more information regarding our events or activities, please go to our website, www.veterans.nv.gov. Sign up for the newsletter. We're also, you can follow us on social media if you're into social media. I kind of do Facebook. I don't do all that other stuff, but we're on Facebook and Twitter and YouTube and everything. So I will post this information on the chat room. And with that, I'll wrap it up so you can get to the rest of your program, Charles.
Great. Thanks, Mr. Wagner. Appreciate that. And we always appreciate you joining us and providing us great state updates. Next on the program, I would like I know Mr. Karen has asked Dr. Comanduri to come on board and kind of give you a medical update. We've got a lot of things going on here medically with COVID, but obviously we want to get people back in to take care of their care and get them the services that they need. So Dr. Comanduri, sir, I'm going to turn it over to you if you're available to provide us a medical update.
All right, great. Thanks so much. Thanks, Chuck. I appreciate it. Thank you for everybody for dialing in. It's great to have everyone, and even if we're virtually together. So thank you. As you know, I always try to just say 3 things. So I'm going to start with the 3 things. So the first thing I would say is talk about really how proud we are of our medical staff, that they've done such a tremendous job. Our nurses, our doctors, our technicians, our EMS personnel, working with difficult COVID patients, complicated patients. It is not easy. Just a few minutes ago, we were meeting about eventually building what they call a post-COVID clinic. Just people who are very complicated and ill may have what they call, you've heard of the long hauler syndrome, may have symptoms over a long period of time. Sometimes even people with mild symptoms can get the long hauler syndrome. So we were working on doing that. But the unit, we created this separate unit, essentially zipped off, taped off in essence. And the staff that works in there, the nurses that are there, the EMS folks, they're there 12 hours straight. So that is a heck of a challenge to be in the peppers and the suits for 12 hours. And I can tell you, last night I walked on the unit and talked to our staff, and they were, to a person, were thankful for what really the VA, nationally, VA at this facility has done to get the right equipment. We gave them the peppers, personal protective equipment, everything that takes to keep them safe. So all our staff have remained safe. They feel safe, and they will tell you they've had their own friends in the community who've gotten COVID exposure through work where they maybe didn't have the same level of protective equipment that we have at the VA. So we have been blessed and very fortunate to have that. So the unit's been working well. We had up to 30 patients at one time. We're down to like 12 as of now. But still, again, we're doing a good job of managing this. Our initial first patient, in fact, one of our colleagues just talked to him. He recovered. He's at home, but still, he's still working to get better. So, and that's the gentleman that was on the news and TV, talked about how he recovered and got his care here. So great news. So we've done a good job of managing COVID, protecting our staff, protecting our veterans. So that's our top priority, and I think that's a good thing. So second thing now is how do we move forward, right? We have COVID. what's going to be the long-term course of COVID. So one thing, possibly we may get a good vaccine over time, and that will help us and in essence get us to herd immunity with lots of people getting vaccinated. That is our hope, right? But the other thing is that will it be that we can eventually bring it down small enough numbers that we can do test and contact trace and reduce it? That could eventually happen too. So hopefully we'll get there. But in the meantime, how do we get back to our business? And as everybody talked about, we do a lot more virtual care, virtual business, and you've seen that. And most of our specialty areas and in primary care and in some of our special areas, we're around 80% of our pre-COVID levels. And in mental health, we've gotten to the pre-COVID levels. So we're getting even beyond that now. So at least in mental health, but we're getting in primary care mental health, we're pushing to get to the levels of work we did before COVID, which is really a positive thing that we're getting the work. Now, some of it is now always face-to-face, not necessarily face-to-face, but it could be video and telephone. And we are pushing more and more VA Video Connect. And so please encourage veterans to use the Video Connect using the app. It's fairly straightforward. I take care of veterans using the VBC. Generally, people are happy with it, so it's good news. We'll work on it. The VA actually has a new program for veterans who don't have a smartphone or don't necessarily have an iPad, etc. The VA actually are getting these equipments so that they can be able to dial in and do the video visit. So that can be assigned based on income eligibility, so that you'll, I think, hear information. So it's almost everyone will have access to a mechanism to be able to communicate through the video mechanism. But of course, a lot of our veterans also want face-to-face. And like I do in my own clinic, I see veterans face-to-face. They want to come in, we'll offer the care. So our goal is to, again, learn to live with COVID, move forward with COVID. How do we take care of our veterans? The third thing I want to say is, the importance of this is we need to get veterans to come in and get their care. As you all know, I've got I don't know if you can see this, I've got my breast cancer awareness tie. If you look at what happened between May and June of 2020, 285,000 breast cancer screenings were not done. 285,000, right? So that cancer were not done. We're about 45,000 colon cancer, so 95,000 colon cancer, about 40,000 cervical cancer. These screenings were not done. So when you look at that time period, there's about the level of cancer detection decreased by 46%. So that doesn't mean cancer didn't happen those months, right? We know cancer was occurring, we just were not detecting it. So what we're going to see over time, during the time when everything was nationally shut down, this is what you're going to get eventually. You're likely to get some excess deaths because we didn't get the diagnosis in time. So the important thing is we need veterans to come back in. We need everybody to get back in to get their care so that we begin to continue and resume. Like we said, breast cancer awareness in October. We've got to resume and get more of the breast cancer screening done. Same thing when it comes to colon cancer, cervical cancer, prostate cancer, everything we need to be measuring and being able to get the preventive care done for our veterans and certainly in the community. So it's important. That's why we want to focus on not put our people at risk by not diagnosing these critical conditions. Overall in the community, if you look at nationally, the rate of strokes and the rate of heart attacks have dramatically decreased when they come to the hospital. It's not that they're not having strokes or heart attacks. What was happening is nobody was coming to the hospital. So there are excess deaths. The estimates are probably beyond COVID numbers. There might have been even like 200,000 excess deaths because folks weren't going to hospitals or getting care and diagnosed in time. So it's important that we resume and get back into the rhythm of taking care of our veterans and doing the care right all across the nation. So I'm going to stop here. Thank you so much.
Great. Thanks, Dr. Kamanduri. Appreciate that update and providing us some background on all the great stuff that's going on there. So, and yeah, it is very important. Please come back and get your care taken care of. So I did want to just say if you do a few shout outs and welcome a couple people here. We do have some of our other executive leaders from the VA Southern Nevada on here. I do see Miss April Creed, who is our acting assistant director. April, thanks for joining us today. And I do also see Dr. Desiree Crawford out there as well, who is our acting nurse executive at the moment. So Dr. Crawford, thanks for joining us today as well. So I appreciate that. And then I do see a couple people from our congressional delegation out there. Miss Alana Simpson is out there from Senator Catherine Cortez Masto's office. And I also saw Daniel Carranza out in the audience from Congresswoman Dina Titus's office. So thank you all for joining us today. One other person I did see out there, I didn't know if she wanted to just give a real quick update on what's going on with her programs. Kelly Edwards, I saw you out there with the Henderson Vet Center. Is there anything vet center related that you wanted to pass on? Okay, maybe Kelly doesn't have a mic. So, but if there is anything, Kelly, just go ahead and put it in the chat box or send us an email. We'll put that out. So we do thank you for joining us today, Kelly. All right, so our next portion of the
Chuck.
Yes, ma'am.
Hey, I figured it out. Yay!
Hey, welcome.
Thanks so much. Yeah, just wanted to kind of give an update on the Henderson Vet Center. We are also kind of echoing what the VA Medical Center is doing, working on our moving forward plan. Very important to us, and with that, continuing to see our at-risk and most risk veterans, of course, face-to-face, but coming here in the new year, the likelihood is we'll be doing much more face-to-face as well as in-group, as long as we get the concurrence from leadership. Continuing to do some outreach, which is very important to the Vet Center. Working with our community partners and, of course, the VA Medical Center. Doing a few things with the National Guard coming up. Let's see how that goes, and once again, hopeful in the near future that we'll be able to get out there a little bit more with our mobile vet center. So here and available if anybody has any questions. Thank you.
Thanks so much, Kelly. We appreciate you joining us today. All right, so we'll go into our moderated questions. Like I said, if you do have something, we do have a chat box there. You can put it in there, or you can email it to vhalaspao@va.gov. And we're just going to take some of the remaining time here to answer some of the questions. We did receive some in advance, so we'll go through some of those. And obviously, if you've got something of a personal issue or concern, we're not going to get into that here in front of all the people that are in the audience today. We will take that back. We did get one email in here since we started, and we will take that and we will contact you one-on-one with that question there. But if you have anything else that you have or question-wise, you can put them up in the chat box as we're talking here. But I'm going to go through some of the questions that we got in advance, and then I will kind of throw these out to some of our subject matter experts to help us assist with. One question we have is, obviously Mr. Karen kind of alluded to it already, was kind of our community care. And there have been concerns from veterans that it's been kind of difficult to get through to find the status of their consult as we've been transitioning that program over to 100% scheduling by the VA. And I guess the question is kind of what is being done to assist with answering the phones or helping veterans get the status of their consults. So I'll throw that out. Mr. Karen, if you want to start on that, or if you want somebody else to take that.
Yeah, I'll kick it off, and then both Dr. Crawford or Dr. Comandiri want to chime in. We've shifted staff over there, and we've added staff over there. We're also looking at, there's quite a few, you have to look at the intake and the output. So our slot utilization and making sure that our providers are seeing the patients that they can. The challenge came in when we had to shift all this virtual care. So now we're being sure to offer our veterans virtual care technology, face-to-face visit, or of course telephone visit where indicated. So getting those slots filled in, there was a lot of turnover and changeover of grids to make that happen. And then that bow wave of community care consults that we talked about from the early pandemic stage has come through. And then at the same time, we added, there's new software systems and the third-party administrator and admission act in our region. It was a little bit of a perfect storm there. So lots being done, actions, reviewing consults, triaging consults, so that anything that is of an urgent nature gets addressed within that same week, and they meet on that regularly. The bulk of our consults are some radiology imaging tests, optometry, and then some dental that are hanging out there. But I'll turn it over to Dr. Komanduri and Dr. Crawford. They might want to offer some more feedback on some of the action plans that are in motion right now.
All right, great. Thank you so much. So a few things we're doing, and we've actually reached out to other facilities to look at some of the best practices people are using with community care. It's a challenge across the nation. All the VAs are facing this challenge. Some of it is also because of COVID. Many more veterans will be, because all these appointments were canceled, became eligible for access to the community care. So we have to look at, one, do our best to bring veterans back in our system, and as Mr. Karen said, fully utilize the resources that we have in-house. The important thing is almost 50% of the consults that are in the community are the ones that are related to imaging studies and optometry. A lot of them are just getting ophthalmology visits. So we're working for ways to kind of streamline this. I know Dr. Strawn and Dr. Crawford have added additional staff to that area to arrange scheduling appropriately and quickly. So we are working on it. I know it is kind of trying to take eating an elephant, right? You got to eat one bite at a time, and we're working there, and we'll do our best. And I know they're adding more resources to be able to answer the phones. Dr. Crawford can maybe add more information.
Yes, you're absolutely correct, Dr. Komanduri. We've added additional resources, and we've also expanded hours and included weekend hours to try and meet that need.
Okay, great. Thank you, Dr. Crawford, Dr. Komanduri, and Mr. Karen. And I do know that the patient advocates have been taking calls as well to try and assist with community care as they can. And I know that they've added an extra set of teams there for those people who have called and complained and looked for some assistance. People who, rightly so, have been waiting a little longer than the days. We do ask for the 14 days, as Mr. Karen was talking about, but we know that some people have been waiting a little longer, and there have been some other urgent needs that might have been addressed. So I know patient advocates have been working hard with the community care team to get at that as well. So we do ask, give us the 14 days on that. The next question we have is, with our volunteers back now, and some of the vendors, we used to have our Red Coat ambassadors here in the facility, and I'm sure this is probably coming from one of our Red Coat ambassadors that's anxious to get back because they are such wonderful people and an important part of our family. They're just wondering when they might be able to come back, or what the criteria will be to bring the Red Coat ambassadors back. So, Mr. Karen, sir, I'll let you start with that one.
Well, we've brought some back on board, the east and west entrance, and some Fisher House activity that's started. The challenge has been following these waves and these surges. And when we had the first COVID positive patient identified in the state of Nevada, which was outstanding in the sense that we were privileged to be able to treat that veteran, but very much challenging because it was so new here to the state of Nevada. And again, I commend the staff for the great work we've done from that first patient all the way through the approximately 600 patients that we've managed here. So for the volunteers, many of them are older adults and are in some of those high-risk categories. So we're watching what's happening in the community. And if you've been watching the news, we had our uptick in July, mid-July, going into August, and then we leveled out and things improved, and now we're on an upward trajectory again in both positivity rates within the community as well as hospitalizations here in Southern Nevada. So we've brought some on board. I think everyone's been safe and we're doing a good job thus far, but it's a moving target. So I can't commit to you to an exact date when we're going to see more volunteers here. We got to flex and adapt depending on what the symptoms and what the positivity rate out there in the community is.
Excellent. Thank you, sir. Appreciate that. This question is for VBA, and Mr. Fritz, you probably touched upon this in your discussion there, but it's kind of a two-part question. If you want to kind of just briefly talk about this again, the question is kind of when the VBA will be open for face-to-face, and there's a part two of that, and that part two is are there any national service officers working right now to help with claims, and how do we get in touch with them if we need some assistance?
Hi. Well, I think, with the current situation, like I said, Reno is going to open to the public. But I think we have something that we call gating criteria, which is was set out by the White House for reopening in some of these facilities where it wasn't medical and federal facilities. So and early on, the gating criteria was just based on a downward trend in cases. And lately, there's been more talk about positivity rate and different things of that nature, and other factors, and the fact of what's going on in the state, what the state is actually doing with the governor. So those criteria have changed. However, I up here in Reno, we have opened just because it's kind of a remote location, kind of like what the hospital there in Vegas is also remote, but it's not populated, and there's no public transportation or anything. And we only have about 10 veterans per day come in for interviews here, and so we were able to still get that approved by central office to reopen. But down in Las Vegas, that's where most of the cases are in the state, and where it has the highest positivity rate and those things. So they changed the rules a little bit. And so I had submitted a plan to open in Vegas this week, just to interviews. But, that plan, since they changed the rules, I'm going to have to rewrite it and see if we meet the criteria. But lately, I think we've been going up in the state, but I think Clark County has been going down a little and getting a little bit better. So I hope to be open soon. To appointments. It'll be obviously limited and social distancing, and we have PPE and everything and an appointment system set up. And I hope to do that soon, and it'll be on our website when we're going to do it, and we'll publicize that. As far as the state officers, I believe we have that information on our website. Val, is that correct?
Hi. Yeah, we have contact information for the various national service officers, veteran service organizations that are co-located with us, as well as the state has VSOs too that can help you with your claim. If you look on our website, yeah, there's contact information for the DAV and VFW and some of the national ones for Reno and Vegas. And I think they're mostly operating remotely right now as well.
Right. So, all in all, I hope to open soon down in Vegas, and we'll see how the opening goes. And it's all based on the environment and the pandemic. So, hopefully, if everyone wears their mask and we follow all of our social distancing guidelines, this pandemic will start receding, and we can start reopening to the public. Hope that answers your question.
Yeah.
Charles, this is Fred. Can I add on to that a little, please?
Yes, sir.
So, as I mentioned before, we're kind of waiting to see what Director Fritz does. But even when those doors open, we are going to be by appointment only, and that'll be limited. If we can do it by virtual, we will do it by virtual. And I just saw a email come out from DAV that they are primarily going to do virtual. They will make exception to that if it's an elderly person without computer access or a blind person, somebody that's absolutely got to come into the office. And I don't mean to speak on their behalf, but I just happened to see the email come out giving the directive to all of their state members, and so I wanted to mention that. And I have been in contact with the VFW Department Service Officer up in Reno, and they're following kind of the same guidelines. So I did post our phone number. If you need help, even if it's with another organization and you need help getting in touch with them, feel free to call us and we'll help you contact your national service officer if that's who you want.
Great. Thanks, Mr. Wagner. Appreciate that. Like we said, it's a team sport between the state and the federal partners here to get our veterans the support they need. So thank you for jumping in there. We really appreciate all you guys do. Next question here. is kind of along the similar lines. It's more of VHA directed, but the question is kind of when will services like enrollment, patient advocates, and billing kind of reopen for face to face here at the facility. Mr. Karen, sir, do you want to take that one real quick?
Yeah, it's been a challenge to set dates because, as we've talked about sooner, or earlier, is you're trying to strike that balance between keeping staff safe, veterans safe, and still providing robust services. So the things that require face-to-face physical examinations, hands-on kind of things, that certainly gets the priority, as well as urgent care. Things that can be handled online or via virtual or phone calls, we're doing as much of that as we can because it lessens foot traffic within the facilities, and keeps people just safer, frankly, for lack of a better term. So what we're doing is we're considering a few different options, trying to be innovative and creative, and maybe getting away, using virtual where we can, and online access, and those that don't have that kind of access, helping them either via telephone, and doing as much as we can that way. We're also entertaining somewhat of a, Chuck and I have talked about this, a welcome center type concept where we can have, maybe you don't have a dedicated spot for enrollment eligibility, but you have a kind of a one-stop shop where we can get you to the right people, to the right format, or connect you just like a one call intervention where you can actually get connected to the right people. So we just can't set dates on this stuff right now. There's a lot more risk than people sometimes appreciate, and that's just the reality of this disease is extremely virulent and extremely catchy, and that is the problem. So in the absence of a mask or distance or good ventilation, you really put people at a lot of risk. So we're trying to avoid lines. We're trying to avoid that type of mass grouping of people coming together. So we just truthfully just don't have dates at this time, but we can still provide that service in the absence of a face-to-face intervention.
Yeah, and we do have all that on our website, kind of all the numbers and where people can reach out to those people for those services. Even though we aren't doing a lot of that face to face, there's national links as well as local links and numbers for those items. I know our patient experience team has a virtual call center that they have set up where they've got their entire patient advocate team. It's like their lead patient advocate, their 4 patient advocates, and some of their My Healthy Vet people assisting with that, and a customer service manager. So that is out there to kind of assist with those needs. I know that enrollment does have some virtual ways to reach into them as well. But as Mr. Karen said, we are looking at some options to maybe offer those services. It probably won't be a open door like it was before, similar to what Mr. Fritz was saying with VBA. It might be an appointment basis or something as we move on down the road. But all options are being looked at to try and ease some of that stuff back in as we go. So that's where we are with that. And then kind of a next question, this is kind of a hospital related question, and I know we've had this question a few times, is the question is when will veterans be able to bring their spouses to appointments with them and not have to wait outside? Now, I know that we have been allowing one visitor to accompany, a caregiver to accompany a veteran who needs assistance and for their outpatient appointments, or if they're getting like a surgical procedure. We've been doing that as well. On a case-by-case basis under special circumstances in our non-isolation units on the inpatient ward, we've been allowing like one caregiver to go up there, obviously not allowing any caregivers or anybody in our isolation ward unless it's an end-of-life circumstance. But anything else that we want to touch on with that? I think we're trying to make sure that obviously, like we said, we're trying to balance the numbers. We can't let a ton of people in, but we are trying to make accommodations where we can. Mr. Karen, sir, anything else you want to add on that?
Yeah, we were pretty stringent on the caregiver and support type individuals. Now we've loosened that up. It's not a straightforward. I noticed in the Valley, a few hospitals are going to a straightforward. Yeah, you can bring a visitor in. We've not gotten to that point for end of life or those kind of extreme circumstances. Obviously, we find a way to get families to be able to connect with their loved ones. And in general, we're moving as the phases evolve. We're moving away from strict caregiver to, if you've got someone with you, in all likelihood, we'll let them come in. We're not taking as hard of a line as we have in the past. But with that said, if we continue this upward trajectory, you're going to see things tighten up again. So no specific date in mind. I don't know if Dr. Comanduri or Dr. Crawford want to comment on that.
Yeah, let me just add that, the challenge that we face is, as everybody knows, our population tends to be older. So what are the risk factors of having COVID, getting COVID, having bad outcomes? Okay. One, age is a significant risk factor, right? Otherwise, obesity, weight is a big risk factor. And other comorbid conditions, hypertension, diabetes, all these other big health conditions are risk factors. Getting COVID, having a bad outcome with COVID when you combine them. So the challenge is, one, our veterans tend to be older and have other comorbid health conditions. And the challenge also is more than likely the spouse or significant other tends to be also older. So now you're putting another older person at the risk of this environment. So that's why we want to be careful about how much risk we want to allow any family member to get into in this environment. That's why we have to be very careful for both instances. I mean, certainly we allow this. Now, the other challenges on our COVID unit, we can't allow families on that unit. Obviously, you don't want them on a unit. Even if somebody's dying, you can do a video visit there. When we've had this challenge, I've met with and sat with families when somebody's elderly and having issues. The struggle is you don't want the entire family exposed or even one more person exposed to a unit full of COVID. That is just not a safe thing. It's not, that's why we have staff working there very carefully. So those are some of the challenges we face.
Great. Thank you, gentlemen. I appreciate that update. Okay, our next question is regarding My Healthy Vet, and I do think we have a My Healthy Vet specialist on the line that might be able to help us with this, or somebody can talk to it. This is can My Healthy Vet authenticate over the phone or add or update provider or clinic changes? So obviously, My Healthy Vet's a pretty powerful tool. We're looking at that right now to see what other services we can do with that to help our veterans reach out and get data. But I wanted to see if do we have somebody over in our customer service section or My Healthy Vet that can kind of answer that question for us? What can a veteran do with the My Healthy Vet to add or update their provider or make clinic changes?
Hi, I'm online. Can you hear me?
Yes, ma'am.
Hi, this is Teresa, and how we can update. You can call the VES service at extension 702-791-9000, and the extension is 15436. And we will get the information and upgrade you that way. We're in the process of getting the virtual. Some places I can do virtual upgrade to a premium, or you can call the My Healthy Vet help desk, and they can upgrade you to a premium as well account. But you can always call that number, and one of us will get back to you and upgrade you.
Great. Thanks so much, Teresa. I appreciate that. And I do encourage everyone to kind of look at that if you've got a My Healthy Vet account and to get that premium access to that, because you can look at the status of your appointments on there with the VA, your VA appointments, the status of your medication refills on there. There are certain appointments that you can request on there over that. So we are trying to do that. And like I said, we are looking to see where we can maybe expand the use of My Healthy Vet in other ways to help veterans get the questions and services that they need. So maybe some more direct scheduling for for move programs or, nutrition programs. So we're looking at a lot of different ways we can try and integrate that program and put you kind of more in the driver's seat on controlling your care, getting answers to your questions, in more easier manners. So please make sure if you've got My Healthy Vet that you get the premium account and work with our staff. They're happy to help you. And once again, that number 702-791-15436. I think I got that right. 15436. Is that correct? So
yes.
Great. Thank you, ma'am. All right. Well, we're right at coming up right at the end of the hour. We have no other questions. I did get a couple private questions here with some individuals, and we're going to work with our patient advocates here. When I get off the line, I'm going to forward those over to them so that we can reach out to you directly and start assisting you with those personal issues. So I do thank you for attending our town hall today. We don't know when the next one will be. It'll probably be after the beginning of the year. And we'll see where the situation brings us, if we have a mix of something in person or if we'll continue the virtual thing. I did see somebody else log in while we were here. We do have Miss Nina Ridgway with us. She's the chair of our Southern Nevada Veterans Community Engagement Board, which is a group of about 50 plus organizations that are working together in partnership with the VA and the state to provide, to ensure that veterans are informed and educated on health and wellness, on suicide prevention, on employment, transition, things like that. So Nina, thank you for joining us today. We greatly appreciate that as well. So Mr. Karen, sir, did you want to provide any closing comments today?
It's just nice to see some smiling faces, although virtual. Nice to see Nina again. I guess I would ask, just be mindful and compassionate to your caregivers, and understanding that they have been here. And we've been walking side by side with our veterans. We never close these doors from day one, the beginning of March through now. So there is, when we talk about COVID fatigue, people are tired, but they are dedicated and diligent. And I'm very, very proud of this organization. So just please understand that they've really been burning the candle at both ends and working really, really hard through this pandemic to make sure that our veterans get the care that they need and deserve. So just be understanding of that. We have some work to do. The access is getting much better at our clinics and here within the medical center. We're working through that backlog in community care as we've shifted and we talked about earlier. We'll get there. We've got some great dedicated staff. We've been very, very blessed. We've been supported on our budget side, on the supplies side, protective equipment. We have the tools that we need to keep people safe and keep them well and to treat them and manage those that do contract COVID. So that's all I would ask. But thank you all for being so supportive of us and our veterans.
And thank you, Mr. Karen, and thank you, Mr. Fritz, and Mr. Wagger, Dr. Comanduri, Ms. Creed, Dr. Crawford, Ms. Simpson, Mr. Carranza, Ms. Ridgway. We appreciate you all joining us today for this town hall. And we have recorded this, so we will put this up on our social media. So if you have any friends or family who were unable to get this, or if there was something we said here today that you didn't quite catch in real time that you want to go back on, we have recorded this and we will post this on our social media. It'll probably be up by tomorrow morning. So thank you once again for joining us. And we do look forward to continuing to serve you. So please reach out if there's anything we can do for you, and we will continue to do all we can to keep you get informed and educated. I would ask you, if you haven't signed up to get news updates from the VA Southern Nevada Healthcare System, that if you go to our website, which is www.lasvegas.va.gov, on the right-hand side of that page, you can sign up for updates from the VA Southern Nevada, so you get our updates kind of in real time as we put those out. We also have our Facebook page, which is Las Vegas VA, and we're on Twitter at VA Las Vegas, as well as Instagram at VA Las Vegas. So thank you again for joining us, and we look forward to continuing to serve you. And with Veterans Day coming up, thank you for your service and all you've done for our country. And with that, I will close today's meeting. So thanks again, and we will talk to you soon. Take care.
Thanks, everyone.